We have two challenges with statins. The first is that we know that some patients can't tolerate them. The other thing is that even in patients who can tolerate them, not everybody gets their cholesterol level as low as we would like them to get. So they may need other medications on top of a statin to more effectively lower their cholesterol. Now, what we've recently reported are the results of a new medication called bempedoic acid. It acts in the liver in a similar way to the way statins do, but it doesn't cause the muscle aches and pains. And the reason why it doesn't cause the muscle aches and pains is that when you take this drug, it's turned off. And the factor that turns it on is in the liver, but not in the muscle. So you get the cholesterol lowering in the liver, but you don't get the muscle aches and pains. And so there's a theoretical advantage, particularly for patients who can't tolerate a statin.
Professor Nicholls led a 4-year clinical study conducted in 600 hospitals in 32 countries. It was the first time that all the participants in the trial were not just high risk, but also intolerant to a statin.
So what we found was the first thing was that this was really well tolerated by patients. So that's important, that it's one thing for it to be effective, but it needs to be tolerated by patients to take it. The second thing was that it lowered cholesterol by 20 to 25%, which was good. But importantly, we're able to show that it lowered the risk of having a heart attack, a stroke, requiring a stent or dying, and it reduced that risk by about 15%.
Nearly half the 14,000 participants in the trial were women, nearly twice as many as in similar studies.
Women are just as likely to die from heart disease as men. We under-recognise it, we under-diagnose it, we under-treat it, and we don't enrol women as equally in our clinical trials.
But according to Dr. Nicholls, the greatest impact we can have on heart disease in both men and women is prevention.
I think society, both the general community and the medical community, have typically had this bias, and the bias is that men get heart disease and women get breast cancer. Women do get breast cancer, but they're 3 times more likely to die of a heart attack than they are of breast cancer. So breast cancer is important. We take that seriously. We should take heart disease seriously in women as well.